things under control now. As hospitals start to get overwhelmed in various parts of the country, as resources start to grow thin, as people are giving up on contact tracing, the federal government can add more, but not an unlimited amount.
So the testing, contact tracing, isolation is already stretched in certain municipalities and areas. And so unless you then reduce gatherings and put those restrictions, that is not going to cope.
And welcome back. Our doctors are tired, scared, and worried. They've been on the front lines of this pandemic for months. The Canadian Medical Association is calling our governments to step up so we can get through this crushing second wave. How much more can our healthcare system take? Canadian Medical Association President Dr. Ann Collins joins me now. Dr. Collins, thanks for being there. Nice to see you. Thanks for joining us. But, you know, hospitals are reaching nearing capacity. Cases are climbing. The flu season is upon us, and the backlog for surgery grows. Am I painting an accurate picture?
Day 247 of this pandemic, and yes, sadly, that's where we are right now. We are hearing great concern from physicians on the front lines. They are extremely concerned. They're seeing their ICUs in certain parts of the country are filling up. Beds throughout the hospital with COVID patients requiring care. And yes, there's great concern that not only will we not able be to meet the needs of COVID patients, but for Canadian patients with other healthcare needs unless we get ahead of this virus now.
So getting ahead of this virus is the huge debate that we're having now in Canada. Tell us, how do you get ahead of this virus? Is it the hammer, a lockdown, curfews? What is it?
So our message is that we, as Canadians, we need to have a coordinated and collaborative response between governments, federal, provincial, municipal, and to be listening to our public health experts. They are the people who look at the science, look at the evidence, and who give us the best recommendations of the day to be carried out in those communities that need measures to change what's happening now. There is not a one-size-fits-all approach to this, but in those hotspots in this country right now, there need to be further measures put in place to protect Canadians, to protect our system.
You said, Doctor, that there had to be collaboration between the three levels of government. Are you saying that you're not seeing this collaboration?
We need to see a concerted and dedicated approach to deal with what we're confronted with now. Winter lies ahead. Influenza potentially lies ahead. We need to have these bodies come together and make this their main effort, to make health the priority.
So now we're winter's here. We're all getting, we're all going to go indoors. There seems to be a disconnect between sometimes what the federal government's saying, what the provinces are saying, what the cities are saying. You can understand why people are confused right now.
Absolutely. There's been a lot of messaging throughout this pandemic, just in terms of the nature of how the virus itself acts and how the science around it changes every day. And public health recommendations have changed throughout this pandemic. But again, that speaks to the need to have a collaborative and coordinated response to this. Canadians, we want to go back to some form of normalcy, whatever that is, but we're not there. We're in this marathon and there's no sign of a finish line in sight. We need to go back to what we've heard about what we can do on a day-to-day basis about keeping our contacts groups small, wearing our masks, all of those public health precautions and preventative measures that we've been hearing about for months now. That's what we can do at the local level. But in order to save lives, we need to have a collaborative response that will help protect our health system.
A collaborative response. That sounds very nice. Dr. Ann Collins, thanks for taking the time to talk to us.
Thank you.